A boater rider navigating traffic, a teacher reviewing lesson plans, and a market trader setting up a stall all have vastly different daily routines, but right now they share the exact same administrative task: registering for the Social Health Authority, or SHA. Registering for SHA is the first step in securing your medical records, establishing a digital profile linking your national identity to healthcare benefits. Looking at the official Frequently Asked Questions document for SHA, specifically questions 39 and 40, we see the legal reality. The document confirms that registration is a mandatory requirement for all residents, but explicitly states there are zero costs associated with registering afresh. To open your profile, gather 4 items: a national ID, a mobile phone, dependents details, and your KRA PIN if employed. For dependents, you'll need birth certificates for children and a national ID for your spouse. If you get stuck trying to find or verify these documents before starting, the authority operates a toll-free help desk at 0800-720-601, specifically to assist citizens during this preparation phase. Taking 5 minutes to gather these documents ahead of time makes the actual registration a quick, predictable task. For those with a mobile phone, the quickest route is the USSD pathway. This operates over the standard mobile network, meaning it requires no internet data and works on any basic feature phone. You start by dialing *147#. The system prompts you to select citizenship, enter your ID number, and set a 4-digit PIN. Next, you declare your employment and civil status, which determines your fund contribution rate. If you are using a smartphone or computer, you can use the web portal at afyayangu.go.ke. Here, you enter your details, verify your account using a one-time password sent to your phone, and upload a passport-sized photo. Using digital-first channels bypasses physical cues and instantly connects your identity to the National Health Database. If you are a salaried worker, the process is largely automated. Companies are legally required to create an employer account, add their employees' information, and remit the 2.75% monthly deduction on your behalf. Even with an employer managing deductions, you should still dial *147# to verify your account is active and properly linked. This excerpt from the Primary Healthcare Bill outlines the recruitment and responsibilities of community health promoters. For the elderly or those without digital access, these promoters provide assisted enrollment directly within the community. If you face system errors or ID disputes, you can visit a physical Huduma Center or SHA branch to resolve the issue in person. These 5 pathways are structured to reach citizens across different locations and employment statuses, though covering every resident remains a work in progress. Once you complete any of these pathways, you will receive a confirmation SMS from Afya Yetu. This assigns your contribution category and verifies your profile is in the system. It is important to note that being registered does not guarantee hospital access. Your coverage only remains active if your required monthly contributions are paid. There is also a known gap affecting citizens who lack formal national identification documents. The government has flagged this biometric barrier as a system failure that currently prevents some residents from completing registration. If you are affected by this biometric gap, you should contact the 0800 help desk or utilize the Community Health Promoter Network to seek a manual override for your registration. Looking at this physical SHA registration update form, we see specific checkbox sections for change of dependents and change of civil status. You must log back into the portal and manually add your spouse and children, because their details do not roll over automatically from the old NHIF system. If your family members are not explicitly added to your new SHA profile, they will be denied coverage at the facility door. True universal health coverage requires both your personal registration and the proactive inclusion of your family. Completing both steps creates a functional medical safety net for the entire household.